Hey guys, Denise here again. Today is Friday, and as usual, I'm going to talk to you today about a topic that I'm sure most of you do not have a clue about. I want to help you understand the differences that exist with emergency care providers. Is everybody a paramedic? Is everybody a first aider? What are the names that these medical professionals and the terminology that is used, what can they do? We're going to talk about that and a little bit more on today's Friday Fragments. Hey guys, thank you again for joining me, and thank you for taking your time to look at this video today. Now, as always, I'm going to start with just reminding you that for first timers, please subscribe and hit the notification button. That way you will always be able to see the upcoming videos that we have, and just get in tune to other videos we have as well. So today we're talking about the terminologies used for describing all the medical professionals that deal with emergency care. Now, we at Lifecycle 360, we provide first aid and CPR classes for persons who are untrained, like we would call those persons lay persons, or persons who just want to be able to help in the times of an emergency. So for me, I'm kind of biased when it comes to the importance of the role of a first aider, and I think people take for granted that you are the one that makes that call. You are the one that is able to do something at the time of the emergency that can make that difference in the person's life. Now, all of us matter, and in terms of going from a first aider straight up to the emergency care, the doctor that is receiving that patient from the E.M.T. or paramedic. But I think for us in Trinidad, we view first aid, well, some of us, in a way that, it's just probably for being able to have a certificate. It's very important, the role of a first aider, as well as all the other roles when it comes to emergency care. The patient is what matters. Onto the emergency medical technicians, they would be doing what we call basic life support, or BLS, which would be much more than a first aider, a little more knowledge in anatomy, much more knowledge in the respiratory system, circulatory system, get trained to do childbirth, deliveries, emergency care, where when it comes to a little higher or a little bit more than what a first aider can do. You'll then have the Advanced EMTs, and the Advanced EMTs and paramedics will be the next level, and both of these would be functioning under the advanced life support or advanced care. Now, the thing is, with the advanced EMTs, there's going to be some limitation when it comes to being able to provide certain medication for any type of resuscitation, for interpretation of cardiac rhythms, and just I think there's a few other things that I don't want to get too much into to make it too difficult. I want this to be very straightforward as possible, but there's going to be some limitations with the advanced EMT and the paramedic. The paramedic is going to be able to give and do things pretty much as what you might find just before, when they get into that hospital setting, into that emergency room, what the physician at the hospital may be able to do, and obviously much more. to the critical care transport, and these persons are going to be doing transport or seeing about patients who are in a critical setting or in a critical emergency. These persons usually will be transporting their patients via air, so you can have them in a fixed wing or rotor wing aircraft, right? So basically this is what you have for the different levels. So this is important to know because we all use this term so loosely, like in terms of everybody being a paramedic, and I mean it's important to understand that everybody is not one, and we need to get accustomed using these terminologies because it shows that we understand the level of care, and it shows that we respect each of the persons who is in this profession. You know, you wouldn't want to be calling a nurse a janitor or calling a doctor a nurse. You know, they take quite offense to that, and it's just because we don't know. So I hope this video is able to help you just get things a little more clearer, that you can put into practice and understand where we all are, and you know, where do you fit in the piece of the puzzle once you're helping out somebody if they're experiencing an emergency. So guys, I didn't want to make this too long. I just tried to be as brief as possible, but also to help you understand that the differences between each one and you know why it's so important. Right, so thanks for viewing, and if you have any questions or anything you're not sure of, leave a comment below. I would love to hear from you guys. So take care and thank you for viewing. I'll see you guys next week. Later. Bye bye.